Here we see a bunch of different vertebrae that make up the vertebral column. The vertebral column is made up of 4 different types of vertebrae. You have cervical vertebrae, thoracic vertebrae, lumbar vertebrae, and then sacral vertebrae that are going to form the sacrum. To tell the difference between the different types, so the easiest one to tell the difference between are the cervical vertebrae. Cervical vertebrae here, you can tell that every vertebrae has a hole down the center of it for the spinal cord to go through. But on the cervical vertebrae, not only do they have the large hole for the spinal cord, they also have these 2 extra holes, one on either side. You will only see these in the cervical vertebrae. These are for the main arteries and veins and nerves to run through the neck. The hardest ones to tell the difference between are the thoracic and the lumbar vertebrae. Just in general, if you look at the bodies between the two, the thoracic vertebrae have more of a heart shape to them, whereas the lumbar vertebrae have more of a kidney shape to them. You can see as far as the body, the lumbar is a little bit more thick. The process on the backside of the vertebrae for the thoracic points downward, kind of like a giraffe neck, whereas the one on the lumbar is a little bit more straight and out the back and a little shorter. The other way to tell the difference is by looking at these top junctures here, where the next vertebrae is going to join with the one above it. For the thoracic, the flat space where it joins is on the back, posterior side, whereas on the lumbar, that flat space where it joins is going to be on the inside medial aspect. When you have a whole skeleton, you can also tell thoracic quite easily because thoracic are going to attach to the ribs. Then we have the sacral vertebrae, which are easy to tell because the sacral vertebrae all fuse together to form the sacrum. Number-wise, there are 7 cervical vertebrae. There are 12 thoracic that attach to all 12 of the ribs. There are 5 lumbar, and then there are 5 sacral, which all fuse together. You can see 1, 2, 3, 4, and 5. This little piece here is called the coccyx, or the tailbone. You can remember this as the times that you are typically supposed to eat breakfast, lunch, and dinner: 7, 12, and 5. For the most part, the vertebrae are numbered, so you have C1 through C7, T1 through T12, L1 through L5, and S1 through S5. However, the first 2 vertebrae, which we can see here, these are the first 2, as well as these separated. That's the first one and the second one. C1 is referred to as the atlas. C2 is referred to as the axis. The atlas, for anybody who knows any kind of mythology, Atlas was the god that held up the world. The atlas is mostly flat across the top and the bottom. This is going to join with those occipital condyles to form your first neck joint. So essentially, the atlas holds up your world or your skull with the brain in it. Under that, we have the axis, which has this little kind of pee-pee projection here. This is called the dens, or the odontoid process, and this would be the front of the axis. This is looking at it from the back. Here we can see them together. This would be from the back. This would be from the front. Atlas, axis, with the dens, or the odontoid process. This is called the axis because that is the axis point for the neck rotation. This is a pivot joint that allows you to rotate your neck to say no. On the thoracic and lumbar vertebrae, they have the same features to them. Again, we're kind of looking at it from the back. If you put your finger through the hole and look at it from the front, it kind of looks like a giraffe. The face of our giraffe, we see a heart shape here, so we know this is thoracic. This is the body of the vertebrae, which will be the front of the vertebrae. These ears coming out to the sides, these are called transverse processes. The neck coming down the back, that is called the spinous process. And you can again see those transverse processes from the back there as well. The horns on top here, which have the flat spaces in the back, those are the superior articular processes. Superior because they're the top of the bone, articular because that's where they articulate or join with the next vertebrae. And it's a process because it sticks out of the bone. The hole down the center is called the vertebral foramen. This piece here that comes off of the body and attaches to the transverse process here, that is called the pedicle. Same thing over here. Pedicle just attaches one thing to the next. It's going to help form the vertebral arch to enclose the spinal cord. That pedicle here, all the way around, just comes off of the body to help attach that to the transverse process. Then we have the lamina, which is going to help join the spinous process to the transverse process. And yes, you will have that plate of lamina bone on both sides of the vertebra. On the sacrum, this is the back side of the sacrum. Going down the middle here, we have the median, sorry, the dorsal median crest here, because this is the back side, so that would be dorsal. And median, because we're going down the middle. Sacral, for the sacrum, crest is the ridge line. As we go down, we can see that there is a little bit of a break here. This is referred to as the sacral hiatus. Hiatus means break. So we have a little break there. Then we have these series of holes going down the lateral sides of that sacral crest. Those are the dorsal sacral foramina. And then you have your coccyx or tailbone. So again, you have cervical with the extra holes, thoracic, heart shape, lumbar, kidney shape, and sacral vertebrae fused together. 7, 12, 5, and 5. For cervical, the first two are the atlas and axis. Axis has the dens or the odontoid process. For your thoracic and lumbar, you have the body, pedicle, transverse process, superior articular process, lamina, spinous process, and vertebral foramen. You can find those same things on the lumbar, body, pedicle, transverse process, superior articular process, lamina, spinous process, and vertebral foramen. On the sacrum, we can see that median sacral crest down to the sacral hiatus, dorsal sacral foramina, and the coccyx tailbone.